Andrew McCauley is a really experienced and respected clinician. He's did a sports science degree initially before going on to do physiotherapy. He's got a very established clinical education training session that he runs. It's always oversubscribed. A really charismatic presenter, big believer in data. He's been using the strength by numbers, force plates and dynamometers for the last couple of years now, and he's a massive believer in how it works. So I sat down with him to talk about how he integrates it, how it works from a time perspective, a financial perspective, and really what is the importance and impact of recording strength data and where that sits. With his unique background of sports science and physio, it was a really interesting insight. So I hope you enjoy. Let me know. So Andrew, you've been using the Axit kit for, God, it's going to be like
2 years.
2 years now, yeah.
Yeah.
How are you getting on with it?
Well, it's interesting. Before we got involved, I'd been looking at it for a long time anyway. So I'd spotted it years ago and actually got in contact, and I was hoping it was going to come. It was only in Australia at the time. And the reason why I looked at it was just because it had the three elements to it, and I was like, oh, and that looks like it covers everything I need. So then when I got the kit, like truthfully, I use it every single day. And I use it for different reasons than I thought I would as well. So I thought, oh yeah, right, great, it measured things, and I'd be looking at especially from a rehab perspective, and just especially getting around kind of good solid data with that. But actually it's helped me with diagnostically as well. So like even with some patients where I'm a bit like, especially around the shoulder, sometimes you can have this kind of, are we dealing with like a muscle tendon issue versus maybe an instability, and often just that testing gives me that kind of like, you know what, that's definitely something that it pushes me towards more of a diagnostic perspective, which I didn't expect as much. But the one thing I really think about tech, and I think when I'm asking physios to try and measure more, which again is getting better, but it's still quite slow considering. I've just done another course recently, and out of the 18, 20 people that were there, only 2 people measure force in their clinic. Was that, and the common feedback is people are scared. And scared not as in of it, but just they don't know what to do with the data, what that data tells them. And a lot of tech stuff, even tech companies are brilliant, but what they do is they often go, and it does this and this and this and this and this and this, and you're like, whoa, 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 whoa. Every physio hates it because you're just going, can you just tell me? And they don't like feeling silly. So physios hate feeling silly, right? I guarantee you that it's like, or anyone like who's been gone through a medical profession, you're often made to feel silly in the situation. But with when you're being told by somebody who's trying to sell you tech and telling you all this great stuff, and you're like going, hang on a second, can you just tell me the absolute basics, or what is that? So since me teaching it, but even me getting this piece of kit, was the first thing I saw was the way they deliver the information on the tablet. I was like going, that's really easy. It's really nice. There's simple data points. There's graphs if you wanted, but they're not overwhelming. There's numbers, there's a left, right, and then they have this really good, nice visual of normative data that they're now collecting. So you can get this kind of, are you in the red? Are you in the green for your gender, age matched norms? So it's just like bosh. And then the other thing about it is patients absolutely buzz off it, because they look at it and they're just like, you can see them when they come back for their review, and they're just like, get me on this machine, I am going to smash it. You know what I mean? Like and that's across all ages. And I just did not expect that as much. I've read the data on research on getting feedback from people, but I didn't realize how important it was across all ages and genders, that they actually are really, really kind of enthused by that. And then they're always like, oh, can I take a picture of it? And you're like going, I can send you a PDF of it. And they're like again, just these weird kind of like, oh my God, that's amazing. Like you've just, invented the wheel, like, you know what I mean? You're just like, no, it's a PDF, and they see it, and I think physios underestimate how much patients like that. And it's the idea of like, especially if you're rehabbing somebody for a long period of time, they just need that. You'll often get them in and they're just a bit like, oh God, you know what I mean? Fucking if I have to do this exercise again, and then you show them data and they're like, right, let's go again. So really simple. When I show physios on the course as well, I happen to show them that one. It's a bit like, they can see actually, look, I give them a demonstration of the importance of impulse, which is basically a combination of peak force and rate of force. And that's what that system shows you really clearly. So I love that piece of kit, and if anyone was to take it away from me, I'd probably be in Wormer Scrubs or somewhere like that, because I use it that much. And that sounds so kind of cheesy, but it's definitely something that I use all the time. Really easy to use, and the other thing is, as well, is like, it's not only force plates, but they have the push pull. And I thought I probably wouldn't use the push a lot, but actually, again, really useful, because they have this, what other push dynamometers don't have, is it's got this connector which you can kind of put, and that can go against walls, and it can go in between your knees, and you can get, it's just, they've thought about everything, and it's really nice piece of kit, really useful, and it looks really cool as well. That's the other.
Yeah, it's interesting the point you mentioned about the force plates, because people from our side, they say, well, I want force plates, we don't need that. Or they
Really?
might say, yeah, a
Oh,
lot of
right.
people's coming in through on the force plates. I think because they see a lot of stuff out there.
Wow.
Now,
Okay.
we also do get people say they just want a dynamometer.
yeah.
So you get that one, but we're seeing that a lot of the inbound stuff is around force plates only.
Wow.
But I think that's because Valve's done a brilliant job with the marketing, and they're really good at pushing out force decks. And so, like, what's your perspective on that? Because I can get it, I can understand the customer. We just want this. Was our philosophy. We try and encourage, because we're trying to help what we think is the best solution for them, which we think having everything is helpful.
Yes.
But what's your thoughts?
100%. Having the different options. Just having the force plates would be massively limiting for me. Just position wise. How are you going to, certain angles of, you can only do certain tests, like for the shoulder with plates. You're going to be limited to loads of things that, especially when it comes to diagnostic things, especially around like 1-to-1 ratios for, say, rotator cuff. Just the force plates will be limited. They're good, but again, if you're going to ask me which one I use the most, the pull dynamometer by a long shot. That's especially for quads, hammies, shoulder, loads of stuff around shoulder. You can get it for the neck, like, but definitely quads, hams, and shoulder, which I see a lot of. Definitely the pull dynamometer. It's really, like, you can do certain things with the force plates to replicate some of those tests, like, because that's the thing about the Axit as well. It gives you all the different positions, and it's got all the research in the back end, so really good educational component. So if I wanted to kind of, because you can't remember it all, like, just, you don't remember it, and that's the beauty. You can go on there, watch a webinar on all the evidence and why those numbers mean those things, and they're always updating that, which is really useful from an education point of view. So again, you can dive in more if you want, or you can use it in a basic level, but even the basic level is perfect. I always say to physios, if you're looking at rate and peak, you're going to get loads out of that. You may not even need any of that other stuff, but it's there for the people who are really interested as well. So it's got that aspect. It's got that intro of being really simple. But if you just left me with the force plates, I wouldn't be happy either. You know what I mean? If that's all I had, I'd be a bit like, I need a pull dynamometer. You can't do quad testing you can't do knee extension with force plates. I do that all the time. ACLs or my tendinopathy. Oh my God, like, it's a massive proportion of my patients with knee pain would be left out there. I don't know what you've got no way of measuring that. You can do squat on it, but you're not going to measure quad. So yeah, no, I would strongly think if that was the case, I would be questioning whether they have some way of doing that already, so they have something else, but surely they don't if they're coming to inquire. I would definitely want to have a conversation, be going, where's your thinking around that, and what else are you doing? So again, that would be like the beauty of talking about the Odin project, is like going, like, where's the education here? And are you just kind of, because interesting, I don't know what you'd probably know this as well, like, people buy stuff like, I've gone to places and they're like, oh yeah, we got one of them. I don't know, no one uses it though. I've been in clinics where they've got like 30-40 grand worth of kit and they haven't a clue how to use it. I've people bought force decks, they haven't a clue how to use it. I've been in NHS departments, even what's those treadmills with, anti-Gs, maybe uses it once a week. Like, people spend a lot of money on a lot of stuff and kit, and actually not really sure. They're just getting it because they think they should get it, and it sits there. I don't know. Do you?
Oh no, all the time, and it's that's my.
It's mad, isn't it?
I hate it from our perspective. If
Yeah.
it's our stuff, it does pain me, and sometimes it happens because you can't always control it. People change, staff change, or whatever. But I hate it because it's like a significant amount of money. It's also,
Why do you think that happens?
I think it can be flavour of the month. They've seen something.
Yeah.
NHS underspends. The number of times that I'll get contacted in March and said, Andy, I've got 50 grand to spend. What can we get? And yet, a lot of the time, it will be in departments. It will be they don't want to speak to you, and then it comes back to communication. Really, they don't want to speak to you, but then it's like, no, we. And again, I'm massively generalising. We know what kit we use, but then they get told, right, you've got 50, 100, 200, 500 grand to spend. What do we spend it on? We need to buy something, or else we lose it next year. What have you got? So obviously, I sell it, and I'm happy to do so.
Of course, yes, it's the game, isn't it? Yeah.
But it's not the right way it should be.
No.
But I think this happens in private clinics as well, and it's, again, I do think there's a lot of, God, well, if they've got it, we need to get it. That's definitely the case.
Which again comes down to when we had a previous interview about the alchemy and the psychological. People do things that just makes no logical sense at all to spend that kind of money. Because again of social pressure or whatever. And what I'm saying is like that the AXA kit is in price wise is absolutely no brainer. Like I always say to people, like, what's one of the main objective things we need to test as a physio? Strength. Yeah, it's one of the worst things we assess. And look, it's got error. Like, I'm not here to say that, measuring all these things, absolutely, there's error in every piece of kit you use. But what you're trying to do is trying to minimize that error as much as possible. And by just getting people using this kit, and you will start to reduce that error by the way you test people, you get used to the kit itself. But like, how you would spend that amount of money without getting education and understanding, and that would scream a lack of education if you're asking for force plates and you've not already got maybe pull and push dynamometry. Because I'd be like going, well, why? How are you going to test that? That would be my first indication, and that would mean straight away that I'd be going, I would have a chat with them and think, it's well worth doing that. Like, you know what I mean? You're going to get these benefits, but I think again the education's not there, is it? There's not many people well, certainly in universities. I don't know what they're getting now. Certain universities, like the problem with universities is it's not the same everywhere. So you get some will probably get experience of it. They may have an isokinetic machine, but an isokinetic machine is very much different to what the AXA system is. You may not get, you can have an isokinetic machine, which is usually going to measure knee extension, knee flexion. And if that's all you've got, then loads of people think, well, that's not going to, how are you going to learn about your shoulder and all that other stuff that you get? So, I think the idea is that it's like doing my course for 10 years, you can see that it's there, but still it's moving real slow. And I think a lot of it's fear. And then, as you said, even when people buy the kit and it's there, they're still not using it. Which, I think I think education is the way forward. So what you guys do is brilliant, because again, you're always looking for that. And I've done a few talks about like patient scenarios and case studies, and I think the more that comes out, I think people will feel comfortable. And even the half an hour I do on my course where people kind of have a look at the kit and I show them that you can see them just kind of going, actually, that's all right. A lot of them are like going, how much is it? And you're like going, well, look, how is it retailing for?
It's around 10 grand,
depending
on what you get.
Like, and you get some people are like kind of like, they're a bit like, but like at the same time, like an ultrasound machine is the minimum 15 or whatever it is, and then and a shockwave is like the same thing, and you're like going, and that they're quite limited to, but the ultrasound has an education side of it, so you need, you can't just buy an ultrasound and be like, oh, let's have a crack at it. Like, shockwave you kind of can, but shockwave again is like, it's for pain and that's, it's either going to do that or it's not going to do that. Whereas like your strength assessment will be diagnostic rehab. You'll also get patients who come in who'll be like going, wow, that makes loads of sense. They kind of go, yeah, the other physio just kind of held my hand, or they don't get what was happening there, and they're going, how did they know I was strong or weak? Or they'll come away going, I can squat this or I can do that. That makes no sense. But when you show them this stuff, they're just like walking away going, this guy knows what he's talking about. So it becomes a marketing tool for you. So with shockwave, you can kind of go, right, I do so many shockwaves, charge this amount of money, I can kind of work out how much it's going to cost. Whereas with the strength kit, you're kind of going, well, how's that going to make me money? And you're like going, it does, because your reputation for, that trust in, look, here's some tangible data that can say that why I'm giving you these exercises or why I think you've got this problem. It's not perfect, but it's certainly going to give you better than me kind of guessing whether you're weak or strong.
Yeah.
And the amount of people are given strength exercises when actually, you know what, a lot of patients don't want to do them. they're bored, they're not into it, they're not into strength training. No matter how much you want them to be, they won't be. And if you're prescribing it to them and they're not into it, and it's the wrong thing, and they don't get better, I'm going to have to unpick that in a clinic in 6 months' time when they're like, oh, I've done all that, it's not worked.
Yeah.
Like going, yeah, and you've now delayed that 6 months because you've not really got it right in the first place, and you're trying to stuff things into patients who don't really like it. So if you've got a patient who doesn't like strength training and you don't need to give them strength training, they're laughing. You just have to give them education, just say, look, you'll be grand, it's not that much of an issue, do this movement over a couple of months, you'll probably get better. Those people skip out of clinic. But physios feel like, oh, I need to give them stuff, and probably strength training is probably, because I can't measure it, I can't say it is or it isn't, so here's some strength training, because that's making, I always say physios like giving themselves a nice tap on the back as they leave, and like going, are you tapping yourself on the back or are you helping the patient? And that comes from what I call therapist anxiety syndrome, where therapists feel like they have to give things to people and their worth is in that. And you're like going, sometimes it's not. It's actually, have you asked them? Do they really want to do that? And that's the strength in measure as well. Sometimes you just have to go, you know what? You don't have to do that.
Yeah.
And they're buzzing with that.
But I think you've got confidence and conviction in what you're saying. And I think sometimes with this tech, and why it also won't be being used, is that I think industry do missell things, and they will say you can use shockwave on everything. And we'll have probably been guilty in that in the past, but it's like, I think it's more about how do we work together on this stuff and say, look, would be really good for that. We're unsure about this bit. What do you think? What would your patients engage with? Would they engage with this even? Because it's like we know the tech, but then it doesn't always align with.
Yeah.
Like, you don't use ultrasounds, do you?
No.
You don't use ultrasounds?
No.
Well, that's fine. Right, okay. Well, then you'll work with Chris Myers or whoever else who will do that. So that's why it's a collaborative piece on this bit to understand. Is it worth, right, maybe we'll look at that. It's a conversation on these things. And I think if you do it that way, it may be that you start off saying, well, we want shockwave, and then you might say, well, actually, strength assessment might suit you better now, and then look at this down the line. Whatever it may be, it's a conversation that I think's important. And one question, so I got an email today, actually, from one of the top, when I say one of the top physios, she works with absolute top athletes, the absolute top ones. And she said, I think she was joking, but she said, how can you get me more hours in the day and more days in the week? So how do you get more time? And we were talking around this sort of topic. So from a time management perspective.
Yeah, that's a good point. Yeah, no, and actually, that's the another. Yeah, I'm glad you said that. So I'm quite stingy when it comes to what I bring in, as in like, a kit. And one of the things is, will this save me time with regards to the setup? And actually so like I've got a mat that has that I pull out, and I always, people probably bored of me if you've ever heard me talk, but literally it's a plastic mat, but it's got a load of like rulers and measurement on it. It's a company that sell it. And I'm like, it's the best 120 quid I spent, because what it does is, and again, I'll move on to AXA because they do the same thing, is that I pull it out and patients are like, whoa, look, it's a piece of plastic with measurements on it, but they're like, right. But they're like kind of like nearly encouraged to see the progress. So it's very visual, but for me, I'm like going, all I have to do is that, and bang, bang, it's all done real quick, so it saves me time. It's the same when I have some apps that allow me to measure range of movement, and I'm like, bang, bang, and it works out all the kind of difference between left and right, and it does it. So I'm saving maybe like 2 minutes here, 60 seconds here, because the measurement stuff, I'm not having to stick bits of tape. You go around physio departments and you have tape stuck everywhere, and people getting a measuring tape out and everything. I don't have to do any of that. I just like, boom, there's the measure, the cone goes to there, app tells me that, and the Axis system is like, boom, boom, it's really easy to set up, it's quick, it goes onto the computer and it goes straight up onto the screen then. So everything is really quick. So when it comes to, you have to do a good job, and if she's dealing with athletes, again, she's going to have to be quite thorough and quite measured as well, because again, making big decisions around capacity of a muscle or a joint. So she needs the data quick and in a really easy way, and a way to show the athlete, so the athlete can get it and go, right, I can do this. So all of that, if you don't have something that's quick and easy, she's going to eat up her time, whereas that system allows you to be quicker. Yeah. So just to look at it from that perspective, you can save time in better tech. and that has to be in how it's displayed, and then you practice it in how you deliver it. But without doubt, that kit, and I've used other dynamometers, so it's not just me just using that. I've used other dynamometers which are fine, but there's a bit of clunkiness about them. It's a bit awkward, or there's restrictions where, again, the Axid, I've got 3 different ways of doing it, and I've got a push-pull and I've got the plates. So from her point of view, if she was interested in tech, that kind of side of things it's great. And you can actually, as well with the tablet, if you've got athletes when you've got more time from the point of view of in rehab time, they can be doing stuff and they can be getting feedback right there, so they can look at the numbers. So you can use it as a way of actually getting people to kind of, you can test them, but then you can get them to use it as a form of treatment. I want you to keep that tension on there, and then when it starts to drop off, right, we ease off, so especially around tendinopathy and things like that. So she could really use that, especially for that top end athlete where those little differences make a big, and they get that feedback straight away.
Yeah. Great, brilliant. No, thank you for sharing your insights on it.
Cool.
And
Don't take it away.
Yeah, we're not going to do that yet, just to clarify. Yeah, good man. Cheers, Andrew.
No worries.